So we know exercise is really good for everyone. I think we all accept that. But specifically for kidney patients, there's been a lot of studies in the last number of years showing benefits. Specific things that have been found, so things like mood specifically, as well as improving the symptoms of chronic kidney disease. As a person moves on towards dialysis, we know that these symptoms such as restless legs and cramps, these symptoms get a lot worse. So exercise certainly helps mitigate these symptoms, so it makes these symptoms a lot better. It also helps with general things such as reducing weight and blood pressure. If someone needs to lose weight, of course, just weight management, helping with blood pressure control, helping with blood sugar control. And importantly, it also helps protect the heart. Currently, we're busy with a really interesting study. We know that cardiac disease, so heart disease, is very common in dialysis patients. So we're looking to see if cycling during dialysis can help protect the heart and help prevent the heart from getting damage in the long run. So we're really looking forward to those results, and a lot of sites all over Canada are involved. So it's nice to see there's a lot of enthusiasm and interest in this topic in our kidney community.
So Dr. Borkum, you talk about cycling, but are there other types of exercise that are also beneficial to kidney patients?
So really any form of exercise is recommended. We generally recommend a mixture of aerobic activity, so things that cause your heart rate to go up, whether it's walking, running, cycling. Then some resistance exercises, so even just small weights, things like Pilates, even just using body weight. And then stretching, so yoga, for example, is very helpful. But to be honest, Deb, any exercise is helpful. Any form of movement, even just taking the stairs at work, is a great place to start. And it's just really important that it's something that you can integrate into your lifestyle, something that you enjoy and something that keeps you interested and motivated. That's really the key.
I love the fact of any sort of exercise that motivates you, and I think key is bringing it into your lifestyle because you're more likely to stay with it. For someone starting out, how often should they look at exercise? How many times a week and for how much time during the week?
Sure, so I think it depends where you're starting from. If you may be recovering from an illness or from being in hospital for a long time or from just starting a new treatment modality, so if you're just starting dialysis, it's always good just to start really slowly and build it up. I think as long as you have a routine, even starting at 5 minutes 3 times a week, and then building it up from there, so doing an extra 5 minutes each session, aiming for a total of about 150 minutes a week of aerobic exercise is the key. But any small amount, as long as you're heading upwards, not staying static, so as long as you're doing more as your fitness improves, as you feel yourself getting stronger, it can take time, but that's okay. As long as you stick with it, you persevere, and you have a routine, that's key.
So you said exercise is good for everyone. Just thinking I just want to make it clear, for patients from the newly diagnosed to those on dialysis to those post-transplant, anyone across the continuum of care can benefit and is okay to do exercise.
Without a doubt. Certainly if someone has, for example, a serious medical condition like heart disease, it is a good idea to chat to your doctor. But in all these studies that are being done, they also look at safety, and not a single one of them has found a safety risk associated with exercise. So exercise is certainly very safe. There may be a few modifications that need to be made, and certainly again that's something you can discuss with your healthcare team. So for example, if someone's on peritoneal dialysis, they may have to clean their exit site after exercising, but generally it's safe for everyone and really is recommended for everyone, even transplant patients. So a recent study has shown that exercising before the transplant, before the day of the surgery, it actually reduces your hospital stay and it helps you recover faster. So really at any stage in your journey, it's highly recommended.
Obviously for patients starting out, always a good idea to check in with their doctor. Any other tips for people that are just starting a new exercise regime?
Sure, so I think find something you enjoy is key. So there's a lot of variety out there, and certain things aren't for everyone. So if you're recovering from an illness, we're not saying you should go out and run marathons, but maybe you'll enjoy doing yoga for 10 minutes in the morning. So really just finding something you enjoy is the key, and finding some variety. And like I said previously, routine is very, very important. And then being patient, I think, is also key, because when one starts on an exercise routine, let's say your goal is to lose weight, it takes a while to get there. So as long as you stick to it and you're patient, you will get there eventually. But you know, you don't get results overnight. But you'll see, before you know it, your fitness levels will improve, you'll have more energy, and you'll reach those goals. It's just about getting there steadily.